Hello, everyone. Welcome to ICRW, and this is our monthly series called Insights to Action. And this event is in honor of International Day of the Girl Child. My name is Jacinta Kapungu, and I serve as Senior Gender and Youth Specialist here at ICRW. We're very excited to have our previous speakers talk about research and programming for specifically tailored for girls, and provide some recommendations on what we as a community can do to advance research and programming specific for this population. So this is an Insights to Action entitled Putting Girls at the Center of Research and Programming, Empowerment, Education, and Employability. I'm going to introduce our first presenter. His name is Daniel Flo, and he is on Results for Development's Global Education Team, where he focuses on amplifying innovations for expanded education access, improved learning, and youth development. Daniel leads R4D's contribution to USAID's Youth Power Learning, leading the cross-sectoral skills for youth community of practice, and helps to co-author Youth Power Learning systematic review of positive youth developments in low and middle income countries. Today he's going to talk about findings from the systematic review as it relates to workforce readiness and employability.
Thank you. How's everybody doing? Thank you, Jacinta, for that intro. As Jacinta mentioned, I'm Daniel Clout. I work at Results for Development in the education team. And Results for Development, we really work across education and health, and we're focused on really improving education and health systems in low and middle income countries. Our work with the education team with Youth Power is focused on positive youth development, which is what I'm going to talk a little bit about today. I think I see sort of my participation in this presentation as a little bit of a background. We're not going to get too specific into programming, but we're really going to talk a little bit more about this positive youth development concept and approach, what it is, what it means, how actually it is going to apply to workforce readiness and employability, and then within that, how it's been applied to gender equity, and providing economic opportunity for young women. So this is, in some ways, a very small sliver of all the data that we've collected for this review, and I'll go into a little bit more about what that means, but caveat that there is a lot more out there about this topic that we can dive into. This is just a cover of our a brief that we did for workforce readiness and employability, which you can download on the Youth Power Learning website, and I'll have all this information I'm talking about today. So first things first, I'll start by describing positive youth development to set a little bit of a background. We'll talk a little bit about this systematic review that we conducted, what it looked at, and what it found. We'll focus in on the workforce readiness and employability findings, and specifically looking at some of the gender equity findings. And then finally, I'll give a couple of program examples to show what the sort of programs we were looking at were. So to start off, defining positive youth development, it is a positive, proactive, and holistic approach to youth development. So as defined here by USAID, it engages youth along with their families, communities, and their governments so that youth are empowered to reach their full potential. PYD approaches build skills, assets, competencies, and foster healthy relationships, strengthen the environment, and transform systems. The gist of this approach is that it is a holistic approach. It is an approach that transitions away from sort of traditional approaches to youth development, and that it doesn't see youth in a sort of problem frame. It sees them as assets. And so it treats them holistically and supports them holistically in order to get the best out of them, rather than think of them in sort of a problem frame. It really is an approach that suggests that if young people have the adequate knowledge or adequate skills, resources, and support, then they will be able to reach positive quality of life, positive health outcomes, education outcomes, and improvements in gender equity as well. The approach is based on working across these 4 different domains. The domains are assets, agency, contribution, and enabling environment. I'll talk a little bit about what each of them means. So assets, we're really talking here about building skills, competencies, and providing resources to youth so they can accomplish what they would like to see in their own lives and sort of lead on their own and be able to get a good job or improve the quality of life or get a better education through these particular assets, which include formal education, but also some of these higher order thinking, critical skills, soft skills that we talk about. There's the agency domain, which focuses on how youth apply those assets, and so whether or not youth are able to apply those assets themselves, make decisions about their own lives, and be supported in doing so. So you look here at positive identity, self-efficacy, and some of these components of youth lives that allow them to make decisions and move on with their own sort of development plan. Contribution looks at youth engagement, and so really looking at to what extent youth are involved in their own communities and bringing positive change in their own communities. And finally, enabling environment. We're talking here about the community around youth and whether or not that community is supportive of them and their goals, provides a safe space for them to be themselves, and so it really sort of allows them to be their best selves and be healthy, productive, engaged people. These all 4 domains are components of positive youth development, and you see that they sort of deal with youth in a holistic fashion, and so a positive youth development would ideally work along these different domains so that it's treating youth issues in a very holistic way. I'll talk a little bit about our systematic review and what we did. So the review really focused on identifying and studying programs that are working in low and middle income countries and taking this PYD approach and understanding a little bit about them, what they're doing, and how effective they were in their goals. So our key research questions were: 1, who's doing this and where, and understanding exactly what they're doing, how these programs have been implemented, which is something that we needed to do. A lot of the PYD literature that's currently out there exists for in the US, domestic settings, and also in Australia and a couple other countries. We needed to know a little bit more about how this approach is used elsewhere. And 2, what does the actual evidence have to say about its effectiveness? And across a number of different outcomes. And I know it's a little bit away from the gender component, but we'll talk a little bit about that as one of the outcomes of these programs we're trying to achieve. At the end, we identified 108 reports on 97 programs implemented across 60 countries. These included reports that were found through a peer-reviewed survey as well as a grade literature survey. So we went through a pretty rigorous process of identifying, extracting data from coding, and analyzing data from these different reports. So that is the systematic review methodology. What I'm going to be talking about is, again, we're sort of zooming in, is a sliver of that database, which is focused on workforce readiness and employability. It's based off of this brief that we developed that looks at those issues. There's another brief that looks specifically at the programs focusing on health. There's another one that's coming out that's focused on human rights and governance and other issues related to that. But this one is the one focused on our topic today, which is workforce readiness and employability. And where possible, I'll try to highlight where those findings have to do with gender equity. Here is just a quick definition of how we coded our programs. And so programs that we classified as being part of this workforce readiness and employability component, they're programs that help youth build and develop necessary skills, competencies, and resources to secure gainful employment. Also provides them opportunities, economic opportunities otherwise, in informal and formal employment. And they can work across other sectors. So again, one of the big things about PYD is that it is cross-sectoral. You could have hybrid programs that try to go for health outcomes, employability outcomes, et cetera. And so this is this is also true for these programs. So that's the background on the data. I'll start going into some of the findings. Our workforce readiness and employability PYD programs were found in 20 countries. You can see here the map of where, in blue, we have all the PYD programs that we found. And in red, we have the workforce readiness and employability programs, just to give you an idea of where we found them. They also work across sectors. And so a majority of the programs we found also had a health component or a human rights component or a governance component. And so these were programs that were working for different and cross-sectoral outcomes. They also focused on all 4 of the different domains, but specifically assets. All of the programs, all of the 33 programs that we found, so 33 out of 97 that were working on workforce readiness and employability, all of them focused on building assets. And that includes fostering some of these soft skills, fostering critical thinking, fostering technical skills to provide youth with more opportunity. So you can see the ones in red are the workforce readiness and employability ones. They also obviously work on agency contribution and enabling environment, but to a lesser extent. And you can see a lot of overlap there also where programs were working across all four. Getting into some of the gender issues that were addressed in these programs. And so what we found overall is that a majority of the PYD programs that we found integrated some sort of gender component to their programming. However, the bar there was pretty low. So for us, if you were doing some sort of differentiated measuring along gender lines, if you had some sort of monitoring to capture gender-based outcomes or gender-differentiated outcomes, that we consider that you sort of integrated that component into your program. Obviously, there are more programs that focus specifically on gender issues, and so I don't want to say that they don't do that, but the bar was pretty low for what we coded for. About 2/3 of those 33 programs serve both men and women. 8 programs serve only young women, and 18 of the 33 programs in workforce readiness and employability specifically integrated gender issues in their programming, so including gender-based violence, forced and early marriage, social and economic gender equality. And here's what we found as far as those programs' impact. And so within that 33 programs, we actually had a much smaller number that had experimental level evaluations and high quality evaluations. And so this is a very limited data set that we're working for to get to some of these conclusions. And that's one of my bigger points. We actually found that there isn't a whole lot of high quality data on a lot of these programs. And so that's something that we really need in order to make better statements about their impact. Within the ones that were considered high quality, that had experimental evaluations to them, we found increases in formal and self-employment, increases in the quality of employment. We found increases in assets and earnings, increased savings, increased duration of employment. We also found increased understanding and ability to apply for a job. And we found some positive outcomes related to adolescent sexual and reproductive health as well. So again, those programs that had that hybrid component of focusing on health as well, we did see that they were still able to accomplish some of those outcomes. When we look at gender equity, we found there were programs within that small group of workforce readiness programs that had high quality data that did have decreases in child marriage, in pregnancy, and unwanted sexual contact, and improved community gender norms and wages for young women. And so that is a positive sign for us that we found that these programs, even though they sort of work holistically along youth, and may or may not have focused specifically on these issues, actually some of them did have some very positive gender equity outcomes. We found that programs that target activities to males and females separately actually had a better impact as well. So you did have opportunities where programs sort of differentiated and segregated the way that they did activities, and those actually were found to be most effective in reducing gender inequality. I'm going to talk very quickly about a couple of examples, just to give you an idea of what we're talking about. So Malik is a program that worked in Bangladesh. Is specifically focused on bringing change to young girls' lives and making sure that the community really value them as assets. And it did so in a number of different ways, both through tutoring and academics and sort of additional training for out-of-school youth on things like computer and financial literacy, but also receiving training on gender rights, negotiation, critical thinking, decision-making, livelihood skills for all the young girls who participated. And they did so in what they called youth centers that were focused specifically on these young women. And they really provided, in our view and in the view of the evaluators, a safe space for the young women to talk about these issues openly and have some good conversations. What we found in terms of outcomes is that it did lead to some increases on the economic opportunity side, including an increase in working for pay as well as a decrease in out-of-school girls. And that it led to a significant reduction in likelihood of child marriage among the girls that were involved, which is another positive outcome. Second example is we have Stepping Stones. It's a hybrid of 2 programs, Stepping Stones and Creating Futures, which combines a program that was focused mainly on adolescent sexual and reproductive health and HIV, with a program that actually had some employability and economic opportunity components to create this hybrid PYD program. And the idea here was to not only have a curriculum that focuses on health, gender, sexual and reproductive health, but also provides guidance on employability, on how to secure work, and doing that all sort of in hybrid. And that worked with both young men and young women. And the outcomes were pretty impressive. You had a high increase in earnings for both young men and women, and higher for young women. There was a significant reduction in the physical, sexual, and interpersonal violence experienced by young women that were involved in the program, and a major change in terms of gender attitudes within both groups. And this is one of the examples that I mentioned before, where the activities were done separately for young girls and young men. You had separate sessions where each were able to speak on these issues, and then also sometimes sessions where they were able to speak collaboratively on those and sort of discuss some of the gender equity components. So those are the two examples I want to leave you with, and finally just some recommendations from our review that I think are relevant to the discussion today. Again, I sort of see this as providing a little bit of a background to what my fellow panelists are going to be talking about. They're going to go much more in depth into programming, but there's a lot more out there for those interested in youth power and positive youth development. A few of the recommendations. One is that we really found that there are programs out there that have proof of their model and have some evidence behind their impact. And so looking at those programs that are working holistically with young women on employability issues, on gender equity, and thinking about how to expand those, thinking about how to evaluate further to understand really what are the components of those programs that are working. Those are all things that we would really support, and I think there's a lot of promising impact out there that if we invest more into, we can broaden. I think that further gender integration is really important in PYD programming. As I mentioned, the bar for how we determine if somebody actually integrated some sort of gender component into their program is very low, and so we really think that more than just providing differentiated data by gender, it's important to really understand how different issues are experienced by folks of different genders and cater the programming around that. And so more integration in the programming is crucial. And then finally, we recommend for researchers, implementers, and all those sort of interested in positive youth development to really leverage the existing resources out there for PYD and the ones that we're currently developing at Youth Power Learning. We have the systematic review. We also have a very useful positive youth development indicator toolkit that was developed by folks here at SRW, as well as our partners at University of Washington, that really give a good guidance on how to collect data on these programs so that we can learn more about them and their effectiveness. And so there's a lot of work out there that's been done, a lot of tools that can be helpful, and going forward, we'll have even more through Youth Power Learning. So I'll stop here. A lot of resources that we can share with you later if you want to know more, but I'll pass it on to Jacinta to introduce our next speaker.
Thank you, Daniel, for providing a foundation for our next discussion. I'm pleased to introduce Karen Sherman, who's going to talk about her work with women at the Aquila Institute. Karen Sherman brings more than 30 years of experience as an entrepreneur, strategist, and executive level manager to her role as president of the Aquila Institute, the only women's college in Rwanda. Prior to joining Aquila, Karen served as the chief operating officer, executive director for global programs, and as Africa regional director at Women for Women International, an organization that enables women war survivors to restart their lives. Her work has resulted in measurable impacts on women's income, health, decision-making, and social networks. Thank you, Karen. Thank you. Good afternoon, everybody. How you doing?
Oh, great. So thanks for having me here today. I'm excited to talk about the Aquila Institute. Has anybody heard of Aquila? Yay! So Aquila is the first and only women's college in Rwanda. Started in 2010 with just about 50 students, and really because there wasn't a lot happening on the girls' education space, and particularly education that led to workforce outcomes. So really our goal is to help women to achieve economic independence and to find their place in the workforce and society. So, we talk about like why Aquila, and I've been to a lot of discussions that are really about girls' education and how we need to create more opportunities for girls' education, but very few of those conversations are around girls' education that leads to specifically workforce outcomes. I've seen a lot of discussions. It's interesting, I went to something recently at the Council on Foreign Relations, and it was billed as girls' education to employment, and nobody talked about the employment side of things. It was all about the supply side, which is all these great young women going on to get education. And so we think education is hugely important, but education that takes it to the next level and helps women to be able to engage in the workforce. And so there's big challenges around that in general, not just for women. But you know some of the statistics. Brookings Institution did a great report a couple of years ago on what works in girls' education, and found that we have a lot of young women starting secondary school, but very few are actually finishing secondary school. And in fact, a lot of countries report on school enrollment, but not school completion. And so you don't get necessarily accurate data on what's happening on that front. And you still have, even in places like Rwanda, where a country has put women to the forefront of the development agenda, you still have close to 80% of women working in subsistence farming earning less than $2 a day. So it's a problem that exists not only in Rwanda, but across the region. And then you have an unemployment gap too. So the fact is, there's a huge number of jobs that are both out there and being developed on a daily basis, but there's this huge skills gap in terms of being able to connect graduates, whether diploma graduates, other tertiary education graduates, directly to the workforce. This is true for both men and women. And in fact, a lot of countries are just saying, well, we're just not going to fill those things. We can't find anybody there. And an interesting statistic is you have an average graduate from a tertiary education looking for 5 years for a job. Imagine going to college looking for 5 years for a job. So that's really speaks to the skills mismatch and how we can address it. And in Rwanda in particular, that skills deficit is about 40%. And the stat about why they didn't fill vacancies. So we obviously know that educating girls makes a whole heck of a lot of sense for a variety of reasons. That women reinvest their earnings in the health, education, and nutrition of their families, that every year of schooling increases a woman's wages by 10% in Africa in particular, and that the World Bank positively correlates education with economic growth in that country. We also know that girls are less likely to marry early when they're educated. They're less likely to contract HIV/AIDS. Their daughters, in fact, tend to stay in school longer and earn more income. So all of the things that we know about education. But it begs the question still, is girls' education sufficient to change the dynamic for girls more broadly? And we've heard lots of stories very specifically of girls who do go on and they manage to convince their families that they shouldn't be married off, they should stay in school. And then they finish their education and then they come back and they're sitting at home. And they're not going anywhere with that education. And actually, I personally feel like it's worse because you've created this expectation that they're going to be able to do something with this education. You've convinced your family, your male relatives, that I'm going to pay for this education instead of sending you off to get married for 30 cows or 50 cows. And then you're sitting at home and there's no return on investment. So I think just thinking about girls' education in a slightly different way is helpful. So our solution, and this actually quote comes from the What Works in Girls' Education, is to build better pathways and bridges to the job market. So our theory of change really looks like this, that when students have achieved mastery of their program and core competencies, and we describe program competencies specifically as English and communications, information technology and quantitative literacy, personal growth and self-confidence, leadership responsibility, career navigation, and critical thinking. Those are some program competencies. There's also technical competencies. So we have 3 diploma programs linked to the fastest growing sectors of the economy. We do hospitality management, information systems, and small business management and entrepreneurship. And I'll tell you a little bit more as we go through that. So when these students master these competencies, they are what we call career ready, and then they're able to find employment. And we have a careers platform that helps connect women to the job market very specifically. So we work on the employer side as well as the student side, if you will. So who are students? So we are really serving the more underserved students who would not likely otherwise have an opportunity to go to college. All of our students are secondary school grads, and they have passed their national exams. Over half of them come from rural areas. The vast majority of their person and their families to be able to go on to college. A number of them are raised in a single-family home, often by a single mother. If you know anything about Rwanda, they classify income according to an Ubudehe system level, sort of the 1s to 5, 1s and 2s being sort of the poor, so the poor, 5 being sort of people who have a little bit more money. The majority of our students are 1s, 2s, and 3s. So even the 3s actually don't have a lot of disposable income. And so we make sure that our educational program is both accessible and affordable to students of all different socioeconomic backgrounds. And here's just a little more information in terms of the other demographics. So as I mentioned, we have 3 diploma programs. That's kind of the breakdown. When we first started the program, we were kind of known as a school for poor girls. That's where you went if you wanted to kind of get a job maybe, and but you didn't have a lot of money. And so we started with hospitality first and foremost because there's a very clear job trajectory. And Rwanda was a growing country in terms of hospitality and tourism, so it just made a whole heck of a lot of sense. And then we subsequently added small business management, entrepreneurship, and information systems, again, because that's where the job opportunities are. And our program is such that you can add different majors and minors depending on what those opportunities look like. So if there's a big growth in opportunity for renewable energy, for example, or community health, then we could add majors and minors in those areas to make sure that those women had opportunities in the job market. So it's a competency-based curriculum, which means that all of our courses are modularized. So instead of just getting grades, you're also measured on your ability to fulfill those competencies. So what's great about that is there's more self-paced learning involved, so the students can work according to how they're mastering those particular competencies. And this applies to competencies on both the hard and soft skills. So on the technology skills, on the leadership development skills, and even on the English language skills, we are measuring both. And it makes a big difference in terms of students who are coming in at different levels. All of them have come from different types of secondary schools. Some of them come in and they've got it really quick, and other ones don't. We actually just started an evening weekend program and found that those students, because they're a little bit older, some of them have been in the workforce before, that their level of understanding is just a lot greater than some of the day students. So that's just brand new information for us that will help us adapt the program. So we just completed our first alumni evaluation, looking at 3 of our graduating classes to see how they're performing after the program. So we were looking at both program effectiveness and results. One of the things the first thing I did actually when I came on board at the Keeler was hire a monitoring and evaluation specialist to be able to have that kind of data. Our data was pretty fuzzy before that. We had a lot of great stories about these young women who had changed their lives, but not a lot of data to support that. So we've changed that. We've used a mixed method approach, and we use surveys and focus groups and key informant interviews as part of this evaluation. And so what we found is that 88% launched their careers within 6 months of graduation, and our graduates on average are earning 12 times the national per capita income. We've also found that 58% have received at least 1 promotion or salary increase since they graduated, and 36% are supervising at least 1 other person, which was great. And then sort of speaking to the multiplier effect and what that means for the family. A lot of the students are saying they learned their leadership skills at Aquila, that 82% are participating in at least one other community group. I thought this was really interesting. 90% of graduates are supporting at least 1 other person financially in their family, either paying for a school fees for a sibling or paying for health care. I think we were speaking about sort of what women are doing in terms of reinvesting, and I think that's a really great statistic. These graduates have only been out of school for just a little bit of time, particularly the newest group, 2015. So the fact that they're already reinvesting in their families, I think, is great. And so just on the employer side of things, for us in particular, we're starting looking at the supply side of things, meaning the girls who need to go to school. We really started our program at the demand side of things. What is that skill gap? What are employers saying? What are they not getting from people who are applying in the workforce, even from traditional colleges, even for people with a full VA program? What are they not getting? Why are they not hiring them? And we use that to help inform the curriculum development. So we have a local advisory council made up of industry leaders, and they have advised us on the curriculum. And we adapt that as we go, because each of our students does 3 months of an internship. We take that data, we use it to continually adapt the program. So we have over 70 employment partners. That's both for internships and employments. And so we really had gone out to look at what the employers are saying about our students, how they compare to some of their other employees. We actually had a group of MBA students from Wharton come and take a look at the program and talk to some of the private sectors to hear what they're saying. And we heard really good things about, how our students, if you know anything about the Rwanda culture, you have a lot of, girls not making eye contact, no firm handshakes, feeling very uncomfortable, speaking when spoken to. A lot of things that, don't really sell well in the workforce. And so our students, particularly these young women, were like the opposite of that. They come in, they shake your hand, they were speaking, and they had a confidence and a security that you didn't find with women more broadly at that same age. And so they were stand-ups in the workforce, and so we felt like we were doing something good. So just a couple of stories, because we have some couple of stories. So the woman on the right is Maria Me. She was part of our first class of IS students. IS is still a non-traditional skill, I would say, in a lot of these environments. And so for our first class of students, we had 8 young women who decided that they were going to pursue IT. In fact, several of her teachers tried to tell her that, no, you need to go into the softer skills. It's not a good thing. But she was bold, and so she recently graduated. She actually won our Founders Award last year when she graduated, and she got a great job at the Radisson as an IT specialist. Which and then Jackie, who is part of our very first graduating class in 2012, she went back to school, had 2 kids, 35 years old. Her husband was like, I don't think you should be doing this. It's kind of like, you don't need to. Her mother actually encouraged her to go. She's like, I need to do something. I want to contribute to the family. So she graduates. She starts a farm. She buys a farm and is employing like several other people. The farm is growing, and her husband is her business partner. So, right? You gotta love that, right? So, just this started some of the questions about sort of recommendations and what we've learned both from the evaluation and just implementing this program is that education alone isn't really sufficient to change the status quo for women and girls. There's not enough return on investment from our perspective. And so in order to really change mindsets, you really need to link education to workforce outcomes. And that programs that build confidence and competencies work best. So it's not enough to just deal with the technical skills. You also have to build the soft skills. And those together are really what make women workforce ready. And finally, that data is key. I could tell you these great stories, but to be able to prove the point, you really need to have more data. And I figured that you would appreciate that message. And just a little bit more, missing that, the vision. But I'll tell you a little bit about our vision. Our vision is to really create a network of campuses across East Africa. There's been a lot of demand for our program across the region more broadly. Girls' education is still a huge issue in multiple countries. So we'd like to set up this program. We'd also like to have some short courses, short certificate courses that students, both men and women, can participate in. We've had a lot of questions from men, and rightly so. Why can't we come to Aquila? And it's not that we're anti-men. We like men, but I think there's something to be said about where you're talking about program effectiveness between men and women. There's something to be said when these girls can come there, and they're the ones who are leading all the clubs. They're the ones who are, governing. They're the heads of the student bodies. Aren't all girls debate team kick butt? So that's what they get to do at Aquila. And so, but there's other opportunities for men and women to be able to do, certificate courses together. We even talked about offering a full diploma course that's separate from Aquila. So I'll stop there, and thank you for your time.
Thank you, Karen. Our next speaker, Ann Stengel, will discuss HIV prevention, treatment, and care among adolescent girls and young women. Ann Stengel serves as the Senior Behavioral Scientist at ICOW. She has 15 years of international public health experience in Africa, Asia, and the Caribbean, with a focus on stigma, qualitative and quantitative research methods, research design, statistical analysis, systematic reviews, and monitoring and evaluation. She is actively engaged in utilizing research findings to inform global policy and action.
Good afternoon, everyone. I think we're going to switch gears a little bit and talk about something a little bit different in terms of adolescent girls and young women's health. Okay, so our world is home to 1.2 billion adolescents between the ages 10 and 19. This is the largest number in history. 2 million adolescents are living with HIV globally, and every hour, 26 adolescents are newly infected with HIV. Adolescents are really at the center of the HIV epidemic, but we're neglecting this generation. New infections among adolescents are increasing, particularly among girls and adolescents from key populations, and so are AIDS-related deaths. 80% of adolescents living with HIV live in sub-Saharan Africa, and girls are disproportionately affected. HIV prevalence can be as much as 8 times greater than for adolescent boys. Oops, something happened to this one. Okay, so it's becoming clear that to end AIDS, we really have to focus on adolescent girls, and this is evidenced by the quote that you see here from Fatima Asil of the African Union. At this meeting, UNAIDS and the African Union launched a joint report that outlined their political commitments to do just that, but what interventions are needed? Where should countries like Zambia, Tanzania, and South Africa focus their efforts and their limited resources? So in essence, there are really 2 places to intervene. Programs can support adolescent girls and young women to prevent HIV infection, and programs can support adolescents living with HIV to transition to adulthood in a safe way, a safe and healthy way that helps them maintain good, strong adherence to their ART and prevent onward transmission. So ICOW is working with partners in South Africa and Tanzania and Zambia on both of these fronts, and I'm just going to go into a little bit of some of this work in more detail now. So since 2015, we've been working with BITS-RHI, the Mwanza Intervention Trials Unit, and the London School of Hygiene and Tropical Medicine to implement the Empower study in Johannesburg, South Africa, and Mwanza, Tanzania. So Empower stands for Enhancing Methods of HIV Prevention and Options for Women Exposed to Risk. So this study really centers around a key biomedical prevention tool called pre-exposure prophylaxis, or PrEP. So PrEP is a daily tablet that you take, and it can prevent HIV infection. So specifically, we're examining a combination of interventions to increase uptake and adherence to PrEP among adolescent girls living at high risk of HIV. So in 2015, the World Health Organization recommended that oral PrEP be offered to individuals at substantial risk of HIV infection as part of combination HIV prevention approaches. So who will benefit from PrEP? Modeling studies suggest that the impact and cost effectiveness of PrEP will be greatest when used by populations at the highest risk for infection, specifically those with HIV incidence that's greater than or equal to 3 per 100 person years or higher. So preliminary work that's been done by the UNAIDS suggests that incidence is at this level in at least one age or gender group in Kenya, Lesotho, Mozambique, South Africa, Swaziland, and Uganda. And throughout the continent, individuals in serodiscordant relationships and members of key populations, such as sex workers, men who have sex with men, and transgender women are likely to benefit from the availability of PrEP. So UNAIDS has set a global target of putting 3 million people on PrEP annually. focused particularly on key populations and people at high risk of HIV prevalence in high prevalence settings, including adolescent girls and young women. Importantly, we know that PrEP works when taken. So HIV risk was reduced by 70% in trials where adherence was 80% or greater. But there are many challenges to adherence, and it's unclear how to foster it, particularly among adolescent girls and young women. So we know that poor partnership dynamics influence adherence. So previous studies have found that male partners' understanding and support of the trial and study products has had a significant influence on women's use of PrEP. While fear of disclosure to partners is a major concern for many women participating in these trials, it was found that when they actually disclosed that you had better adherence to the study products. So also in previous studies, ART use was perceived to be associated with HIV illness by the male partners. So unintentional disclosure of product use occasionally did lead to relationship conflicts. There are also concerns about potential stigma of using these types of products, and that led to concealment of use of study products and lower adherence. So as I'm sure many of you know in this room, adolescent girls and young women around the world experience extremely high levels of intimate partner violence. As you can see here from this study conducted among 15 to 19-year-olds across 6 cities, including Johannesburg, prevalence of IPV ranged from 10 to 36% and was highest in Johannesburg. We know that violence against women has serious consequences for women's health that include fatal and non-fatal injuries, mental health problems, poor sexual reproductive health, obviously including HIV. We also know that violence limits the treatment cascade, and I won't go through all these steps here, but just wanted to point all this out as background to lead into the intervention itself. So the Empower intervention was designed specifically to address some of these challenges. You'll see here the primary objectives of the study are to evaluate the feasibility, acceptability, and safety of integrating screening and linkage to care for gender-based violence and stigma within HIV counseling and testing for adolescent girls and young women, and supporting PrEP acceptance, effective use, and retention in care through adherence clubs that include a 4-session empowerment curriculum compared to counseling and SMS support alone in HIV-negative adolescent girls and young women. Oops. Oh, Joe. But oh, I'm like, oh, I need to stop. Okay, there we go. Okay, so what you see here, and I won't go into detail on this, is really just the flowchart of the study. All participants receive a prevention package, which includes quarterly HIV counseling and testing and GBV screening plus linkage to care, provision of contraception and STI care, risk reduction counseling, and community dialogues on HIV and gender-based violence. Randomized participants receive monthly adherence clubs with an empowerment curriculum versus a standard adherence support model that just has counseling and SMS or phone reminders. And the primary outcomes of this study are PrEP acceptance and adherence and retention in care over 12 months. So this table gives you a quick snapshot of what the 4-session curriculum entails. The sessions cover gender roles and social norms, sexual and reproductive health, power and control, and empowerment. I don't obviously have time to go in great detail over each of these sessions, but I just wanted to let you know that the Empower curriculum aims to build good communication and conflict resolution skills and support safe introduction of HIV prevention methods, including PrEP, within relationships. Okay, so now I'm going to switch track and switch gears and briefly tell you about some work that we're doing with adolescent girls living with HIV in Zambia. And these girls are aged 15 to 19. So with support from the MAC AIDS Fund, ICRW has been conducting research in Lusaka with our partners Zambart and 3C Consulting since 2015. And this research is really intended to understand the challenges that adolescents living with HIV are facing and their support needs. So we had an initial formative research study that took place between 2014 and 2015. And during this study, we gained a number of insights into the challenges that are facing adolescent girls living with HIV. So these included a number of things, as you can see here. So lack of emotional support, a lack of tools and advice to help with decisions around disclosure, a lot of anticipated stigma, and challenges around taking their treatment. The girls also had specific gaps in their knowledge about HIV, particularly around treatment as prevention. They basically weren't being given information that the drugs they were taking would prevent onward transmission. Many of the girls' families feared casual transmission of HIV, which led to stigmatizing behaviors in the home, like separation of plates and cups and not being allowed to play with younger children. And in general, there was a lack of opportunity to discuss issues around HIV. And also harmful norms around morality and gender really persisted despite years of HIV prevention care and treatment messages. Okay, so we also found a number of challenges at the clinic and in the school setting. So the girls were, at the clinic, they were really worried about being seen going to the clinic or while at the clinic. And this is obviously related to fears of disclosure to people they know in the community. So they also described long wait times and administrative challenges, which led them to miss a lot of school because they had to go regularly to the clinic, and we all know that missing school is a bad thing. So the information provided by the counselors at the clinic was also a bit problematic. It was often very focused on adherence, and there was a lot of moral messaging. We call that about abstinence, where they were basically told you shouldn't be having sex, so please stop asking me about reproductive health. So at school, the girls were very worried about inadvertent disclosure of their status. So disclosure was extremely limited. I mean, very few participants had ever disclosed to anyone at school. And lastly, HIV-related messages that were provided by teachers at school were often outdated and judgmental towards people living with HIV, despite the fact that Zambia has been living with the HIV epidemic for a really long time and actually has strong curricula that they could be using in schools. So all of this to say that we came up with several intervention recommendations after this formative research, so that you can see them listed here. The first is that we really need support groups and peer-to-peer education. And this would provide a forum for the girls to meet and engage with other adolescents living with HIV and to be supported regarding both their emotional needs as well as their medical and disclosure-related needs. Most of these girls had literally never met another girl living with HIV prior to this, participating in this study. So that was, I think, a hugely important need for intervention. So secondly, information sessions and counseling support for parents and guardians of adolescents living with HIV are really needed to increase knowledge about HIV and encourage open discussion with their children. Other things at the clinic include procedural changes that could reduce waiting times, support engagement in care, and reduce school absenteeism. Training is clearly needed for adolescent counselors alongside new tools so that they know how to discuss sex in a neutral way and to really discuss all of the issues that around sexual and reproductive health with these adolescents. One thing to point out is that Zambia has a really great comprehensive sexuality education curriculum for schools that includes a lot of new information about HIV, but there are some things missing from that curriculum. There's nothing in there about adolescents living with HIV. There's nothing in there about stigma, harmful gender norms, or GBV. And obviously, these are all things that young people should be learning about. So one of the suggestions we had is to add some new lesson plans to address these issues. And lastly, then we want to train and supervise teachers to integrate this comprehensive sexuality education curriculum into their lessons throughout Zambia. So just very quickly, I'll just tell you about the current phase of the study that we're in, which is that we're now piloting some of these interventions. So far we've developed those new lesson plans I was mentioning, and the Ministry of Education was really excited about them and has integrated them into recent teacher trainings of the CSE. We don't unfortunately have the money yet to evaluate that component, so right now we just have the tools and hopefully they're going to be used. The next part we're actually going to be evaluating though, which is that we developed a 6-session support group curriculum, and this is really meant to be an empowerment intervention for these young women. These sessions were developed in a very participatory way with input from adolescents living with HIV, the Ministry of Health, NGOs, and healthcare workers. Each session is about 2.5 hours long, and we're planning to implement them every other week. They're designed to be facilitated by 2 facilitators, ideally including a peer, alongside a trained participatory facilitator. And obviously, because they're young girls, all of the exercises are participatory. So this is another slide that's a snapshot of the topics that we cover in these sessions. So you'll see here that the first session is about getting to know you, and then we move into disclosure. And there's a whole session on everything you want to know about ART. It was very surprising how little these girls knew, even though they've been taking ART for many years. Relationships. This was a hugely important issue that the girls wanted to talk about. Loss and grief. Many of these girls had lost their parents at a young age and had never been able to work through that. And so we thought that it was important to add this session as well. And lastly, sort of a celebration session that allows them to plan for the future. So I just want to point out that we, after the first formative research ended, the girls were really super engaged, and we felt this need to continue supporting them. So we had these informal support groups for about a year afterwards, and they were amazingly supportive of us in this next phase of the work, really helping us to think about what, if we have to hone it into 6 sessions, what should they be about? So these sessions really come from the girls themselves. Okay, so I'm going to end there. I don't have any results to share with you yet, just the interventions, just by thanking all of the study participants, the clinic staff and volunteers, and of course our funders, Matt Gates for the Zambia work, and DFID through the EAPS initiative for Empower. And to leave you with an inspiring quote from one of our study participants who said, "I don't want anyone to think that because I am HIV positive, I cannot do it." So thank you.
Thanks to our speakers. Just want to highlight some key messages about the importance of addressing gender-related issues, linking education to workforce development, also creating partnerships with employers so that we can create opportunities, employment opportunities for youth, engaging men and boys in our programming because they can also help to improve health and workforce development outcomes. The importance of data and evaluation. In systematic review, we found that several programs we had no evaluations done. And so in order to really advance the evidence base on positive development, we need more data and more evaluations in low to middle income countries. And also a key message about creating safe spaces for girls to talk, to build their skills, and to provide those opportunities where they can feel empowered to contribute to their communities. Next, I want to open up for any questions for our panelists.
Hi, Suzanne Petroni. Thank you for those presentations. It's good to get a reminder of some of what the systematic review found. And also see that some of what you found is reflected in the Aquila Institute's programs. I wanted to ask Karen about the Institute. Can you talk a little bit about the funding for the Institute? And sorry if you did and I missed that in terms of the students and what do they contribute? Where does the rest of the funding come from?
Great question. Are you taking multiple questions? Do you want me to just answer?
Yeah, you can just answer.
Okay.
It's an excellent question. I'm glad you brought that up. So, you know, right now the students pay about $850 a year. That is not the cost to serve. The cost to serve is closer to like $4,700 per year. So we fundraise for the gap essentially between what the real cost to serve is and those students. So, you know, in order for our program to be accessible and affordable, I mean, we can't really charge a huge, you know, a lot more than that. We can go up a little bit, and so what we've done also is we've created a student loan program so that students are able to finance up to 85% of their education, and with pretty favorable payback terms really after they graduate, which is one of the main reasons that our benchmark for getting a job after graduation is about 6 months, because that really is the grace period before they even have to start paying that back. So, you know, obviously it's a challenge for us too, because the more women we take into the program, there's the gap that we have to pay for. And so we're really trying to true that up. And so a couple of things that we're doing is, we're moving to a blended learning model with the competency-based education, so there'll be online and offline components. I'll be telling you more than you ever wanted to know, but it allows us to decouple our faculty with the classroom and have faculty at different levels, including teaching assistants and other things. So all that to say is to bring down our cost to serve through a variety of mechanisms, operational efficiencies, the blended learning, et cetera, and then gradually be able to increase the tuition as the economies grow and then women are able to earn. So I don't mind fundraising for a gap, and particularly for needs-based scholarships, but that shouldn't define the financial model. It's not inherently scalable, so those are some of the changes that we're making to address that.
And if I can just do a follow-up on that, some of the companies and industries that you're training young women for, hospitality, for example, are those donors? Are you?
Good question. You know, it's interesting. They love our work, but you know, we really struggle around the pay-to-play kind of thing. Yeah. And the fact is, we want them to hire our young women on their merits, and I don't want it to be like, well, you know, yeah. So, I mean, like Marriott, for example, is one of our largest employers on the hospitality side. I mean, they're the largest hospitality, company in the world. So, but they've taken probably even 60 of our graduates and put them through not just their regular program, but even on a leadership track, so that they can work not only in Rwanda but around the world at some of their other properties, which is awesome. So they give us a small donation just as a gesture, and they have supported some of our other activities. But in general, the private sector partners are not donors. We'd rather say, yeah, I'd take 30, 40 girls, I'd be thrilled. Yeah.
Dan, I had a question. You were talking about how in Zambia they have a good comprehensive sexuality education program, but they don't necessarily integrate gender-based violence. I recently did some TA with the Positive Development Program, which had the good intentions of integrating gender and also GBV, but they were unprepared to deal with some of the legal and ethical and programmatic issues related to GBV. Can you highlight what are some key things for people to think about as you're integrating such sensitive issues into programming?
Well, I think for us, the key thing for anyone really is engaging the Ministry of Education from the very beginning. So that's what we did. I mean, because before we started, we wanted to make sure that they were okay with this, that they saw why this was important, that they saw it was missing, and then we carefully crafted the sessions to be something that would be kind of acceptable. We obviously based a lot of the material on existing curricula that do a good job at these things like stepping stones and others, so that we utilize material that's already been evaluated as much as possible. But I think that initial engagement, and for us it was interesting because I'm a health person, so I'm very used to working with the Ministry of Health. This is the first time ever that we've engaged the Ministry of Education, and we were really pleasantly surprised. In Zambia, they were really, really supportive. So they liked the sessions, and they but one of the things that we had to also do is we had initially framed it as kind of adding new topics, but that didn't go over well. What they wanted was sort of lesson plans to add on to existing content, because it's already a very large curriculum that teachers have trouble integrating into their kind of the regular lesson plans. So just kind of listen to your stakeholders, I guess, is the biggest.
Yes, partnering is important. Yes.
Hey, my name is Whitney again. I have a question for Ms. Single. You were just talking about integrating the lesson plans. How are you working with the Ministry of Education to make sure that the lesson plans actually get to the teachers in the school? I was actually Peace Corps in Zambia and have seen that as an on-the-ground program of the ministry having the information, but it actually getting to the teacher level. How do you deal with that challenge?
So that is the biggest challenge, and that's why the standalone CSE as it is now is really not being utilized, because they have teacher trainers that the Ministry of Education sends out, but they only do a few trainings, and then the teachers don't really have the resources to integrate. And as you probably know from working in that system in Zambia, they have this great curriculum, but they also then have, here's what you teach for history, and it's not naturally integrated. So it's sort of up to the teachers to figure out, well, how do I take all of this information and integrate it? So I think there's a missing piece that they really need to work on, which is that full integration. But then I guess right now what the Ministry of Education is trying to do is they're doing these refresher trainings. But I think it's going to obviously take more than that, and probably it will take financial support from external folks to really make that push alongside an evaluation. An evaluation was just done that basically found that the curriculum wasn't being used. And so hopefully the government is moving towards the next steps about what they do about that. But right now we're just sort of trying to be as supportive in that process as we can. Lydia, you had a question?
Oh yeah, I have a question for Akira. I find it really intriguing that the gap that you're trying to bridge in employment is actually the disconnect between what the market needs and what is being handed out from regular school curriculum. But I'm also interested in trying to look at the fact that most of these economies don't generate enough jobs. The economy is not growing at the same rate of the graduates. So there's a very high unemployment rate. And so I'm interested to understand from your model what you're doing in terms of job creation, as opposed to just feeding into the job market available jobs. And I know you've mentioned something about entrepreneurship, but there's entrepreneurship and then there's a gap in terms of capital. Is this something you think you will do, or is this something you already do?
Question. Truthfully, we can't really control necessarily the creation of jobs. Rwanda happens to be a country which is on a pretty high growth trajectory. They have about 7% growth annually in terms of the economy. They're also facing that challenge too, because one of their big goals for their Vision 2020 is to move men and women from off-farm jobs, because you still have that big stat of women working in subsistence farming. And so it is a big question, can the economy create enough jobs to support Aquila graduates number? It's one of the reasons that we're looking at regional employers too. So a company like Marriott, which has multiple properties around the region, if our students can't get a job there, they could also look elsewhere. It's also the reasons that we picked those other two majors, IT and small business management and entrepreneurship, because those jobs also will carry beyond a country's boundaries. But you're right, I don't know if these economies can grow as fast. But right now, all the projections are really around these economies growing, and there are a lot of jobs available, and it really is a skills gap question. Your second point around entrepreneurship is well taken. I mean, what happens is it's a 2-year diploma program. So we have there's basic courses in the first year, and then in the second year, the students can say, I want to do entrepreneurship or I want to do small business management. We even have a lot of students who actually want to go into a job before starting their own business. But we run entrepreneurship competitions within the entrepreneurship program. We have something called the Aquila Enterprise Fund. So these students do compete for cash money to be able to set up their small businesses. And so you need the technology, but you also need the link to credit. There still is a larger enabling environment question around access to financial services, which again, a little bit outside of our scope, but having employment partners who are aware of that, including the graduation speaker at Aquila this year is going to be the head of the Bank of Kigali, right? So that's how you kind of bring it together.
I have a question for you, which is why are you not including healthcare? Because there's a massive shortage in terms of people going into healthcare. So I would think there would be lots of jobs. Of course, we know that they're poorly paid because of their government jobs, but it just seems like another area that would be.
Absolutely, it's on the short list. So frankly, it is. I think it just, I'm not an academic by training. I am an international development professional, so to do sort of the due diligence to make sure that there's going to be jobs in the healthcare space, not just now, but down the road, and how much specialization do you need in a particular area to be able to get those jobs, particularly higher paying jobs. Those are things that we're still exploring, but there's a lot of feasibility work that will be done to help us do that, as and the same thing with renewable energy. We've heard that there's a lot of jobs coming in that space, but sort of being really meticulous about how we design the program, and that, again, making sure that the educational piece links to real workforce outcomes for these women. But because it's modularized, we feel like we can, I mean, if we go into Kenya and they say, no jobs here, lots of jobs there, you know, kind of shift. You shift, and you can cut and paste some of your, particularly your soft skills modules, combine them with other hard skills modules and the career competencies so that you can, you know, I don't want to say churn out, but, you know, develop other programs fairly rapidly. I think so.
Yeah, I'm Paul from Visionary Network. I've got a question. I love the PYD framework, also the model that you're running with Aquila, and also these extra programs around reproductive health. I'm curious, you see in the US and other countries national curriculum standards promoting things that are included in the PYD framework, like engagement and personal development and self-awareness and things that are in there. I'm curious what aspects of your programs you think are most ready for the larger educational systems, fraught with all their challenges at the ground level, that they might be able to adapt sooner than later compared to other aspects.
I mean, I think from my perspective, I can only speak from the research perspective, right? And so I think, you know, I think what we see is that programs are already taking this sort of holistic approach, and they have, you see a lot of sort of youth-centered approaches, or even just techniques of dealing with particular sector outcomes that bring in the broader community, to bring in, you know, youth mentors and things like that. And so I think, to me, that is most appealing as far as the reach that it can have in policy. I think that those specific approaches of reaching out to communities, reaching out to youth, you can do similar programs than you're already doing with specifically sort of government implementers, but you can do that with the broader community to get at that enabling environment component of PYD in a way that I think could be really effective. Because I think a lot of programming that we see in that isn't sort of NGO centered, that's sort of government centered, you have a lot of these programs that are trying to reach specific outcomes, and what the PYD framework provides us is broader community support behind those outcomes. So it's not just about teaching a skill to get a job, it's providing also a community with the power to support that individual to get a job, or the sort of support that it could to really help them to sort of reach out and broaden their horizons to get and secure that job. So I think those particular approaches, those particular sort of extras, in addition to the training component, is something that can be broadened out even more. I don't know if you guys want to say.
Just, you know, we're part of, we're actually leading a working group at Brookings on school to workforce transitions, or school to work transitions, and there are surprisingly few models out there that are really addressing this. There's a lot of organizations focused on girls' education and quality education, access to education, education and health, but very few that are focused on the employability. Like, I think there needs to be more models that are country and regional specific, that really test out what's going to work in different ways, that creates that trajectory for women to be able to go beyond even secondary education and what comes next. And I'd love to see something that's scalable. I mean, we're trying to do our own scaling in the region, but like, frankly speaking, I think what I've said here could also be, I've had women come up in Pakistan, for example, and say, I want this program here. I mean, I think if you can get a couple of models out there that really can work, I'd love to see this happen, because I think you are seeing, you know, we've crossed that barrier. We had, you know, our Millennium Development Goals and getting girls into primary education. Yay! Now we got the Sustainable Development Goals and getting girls into secondary education. Yay! But then what comes next? And you have the workforce participation rates, women's economic participation rates are bottoming out, including in this country.
Especially for young women.
Especially for young women. So I think there needs to be more pushing, and also to take the stovepiping that's happening on the youth workforce development stuff and the girls' education stuff, and mix it all up and see what we end up with.
And I would just add that we have to have data for this to work. And that's the challenge, is it's difficult to get the funding. You can develop an intervention, you can develop a curriculum, but to actually be able to test it on a large scale and say, is this better than what we have been doing, and to really then measure perceptions of gender norms and support for, you know, gender equity, and those things are not being measured, and without the data, you're not going to be able to convince the ministries of health, like, oh, this is important, we should do this instead of that. So I think I'm a big data person.
I think that's, just to add to that, I think it's totally right. I think what we found with that sliver of the PYD programming that focuses on workforce readiness and employability and focuses on gender and has high quality data, that's like, it's very small. So, you know, if we want to really meaningfully think about how to incorporate those different services, I think that we need more evaluation. Thank you.
I have one more question on HIV stigma and adolescents. So for a while we've had now PM testing been quite successful, and so there's children who are infected at birth now. I think adolescents at this point. Do you see any difference in terms of communities and how they react in terms of stigma when an adolescent has contracted HIV, probably, you know,
Vertically
versus the other way, right?
Yes. So interestingly, when the children are young, there's a big difference. Oh, no, these poor children, you know, this isn't their fault. The minute these girls hit adolescence, they basically say it doesn't matter. The minute people find out, they just assume they've been sexually promiscuous. So it's very interesting because the younger girls coming up who've been living with HIV this whole time, some of whom they find out at varying times. Some of whom just are told at adolescence, which is also problematic because they find out this big news at a moment when their life is changing dramatically. But some of them do know, and they can see the shift in the treatment, how they're treated, and also pediatric centers and centers that are geared towards kids living with HIV tend to be much more supportive environments. And then when these kids are transitioning into adult care, it's a mess. They're not feeling accepted. They're dropping out of care, and literally the greatest AIDS-related deaths are among adolescents. So what we've done is we've been super successful at keeping these kids alive, and then we sort of totally ignored them. And then we're like, okay, you know, and then we focus on like older, you know, men and women, and that's it. And so that's what we're trying to sort of fill the gap, is to sort of get programming for this sector, this whole section.
Mary, you talked about your work on the employer side. We recently did, Lydia led this initiative. We did an evaluation of a workforce development program. It was a poverty development program in Mozambique. And one of the challenges was, although the program sought in terms of building skills, building competencies, we found that employers weren't necessarily accepting of increased communication or their feelings of empowerment or voicing their opinions. And so there were some challenges between the employer and the youth being given opportunities, because there's a sense of that maybe they may not be skilled to do it. Maybe they might have like a issue with them being so young. What strategies have you found useful in terms of engaging that employer side? And has there been any trainings that you've done with the employers to be more accepting of whether it's a girl or you being employed?
I think, you know, starting with the employers and working backwards has been really helpful for us, that we engage them from the very beginning, not just because at the end when you're looking for the jobs, but at the very beginning when you're sort of setting up your framework for your program, developing your curriculum, and sort of what they're looking for in employees. So if there's still a mismatch between sort of the students that are coming out and the employers are saying, well, maybe they're too pushy, or maybe they're this, or they're not ready for leadership, you know, that kind of feedback would come out in sort of the internship evaluations or the regular conversations that we have with employers. I think I mentioned that we have a local advisory council made up of industry leaders, and particularly as we were undertaking this new curriculum, this competency-based curriculum, we held like a half-day symposium with the employers to really understand what they were looking for, what we could do differently in terms of our curriculum as we were revising it. And so hopefully when you do those things, as you're sending your students, your graduates out into the workforce, you're feeling like that there is a mismatch. There's always going to be cases where, you know, this woman or that person doesn't have the requisite skills that you thought, and so that's where we've gone back and had to tweak our curriculum a little bit more.
Just does your school have a career support after these women have graduated and gotten into the workforce that they can tap into maybe for a year after graduation? for alumni career support?
Yeah, I think I mentioned this careers platform that we have that does this matching between the employers and the students, so they can access that whenever, like if they wanted to look for a new job, or they still can access that platform. In addition, we have an alumni association. We're actually having a big event just in a couple of weeks where we're having an employer roundtable, and they are able to ask questions. We're having a big career fair, so that's being open to alum and students who are just about to graduate. So we try and engage with the alum, and frankly speaking, the alum are our best advocates for coming to Aquila. They are really good at recruiting their siblings, their neighbors, their friends who say, "You can go to Aquila." So it's been selfishly speaking, it's been a great engagement strategy for us, and hopefully.
Yes, I have a question for Anne. Hi, I'm Garthelia. I'm an intern with the Hunger Project. And I was curious to know how these young women and young adolescent girls in the community are receiving their counseling treatment, whether it's through, is it administered from each community has their own facility, or is one facility structured for the district where a couple different of the neighborhoods and towns would come to that one facility to help their disclosure of privacy? How do you guys approach that?
So it depends on the country, I think. So in Zambia, at least we've only been working in Lusaka so far for this formative work. So there's sort of a Center for Excellence, Pediatric Excellence was one of the study hospitals that we worked with. And that is an ART center that's situated within that clinic. And then they have district level hospitals that usually have ART. That's where folks go to get that care. But the issue in Zambia is that oftentimes it's sort of labeled, or people know, like that's the part of the clinic where you're going if you have HIV. And this was, interestingly, this happened in a lot of places, sort of thanks to PEPFAR dollars. And it was sort of like, hey, build this beautiful clinic. And then it's sort of, here we are. Oh. So, I mean, it depends. So sometimes it's great to have very targeted care and support, and that's supportive and where people aren't going to feel stigmatized, but then they have to deal with this whole issue of, am I going to see my friend or my neighbor? And so what we see happen a lot of the times, especially for healthcare workers living with HIV, they travel for miles to go to a different ART clinic that is not at all where they are. The youth can't really do that as much because they don't have the means to get there. So that is definitely an issue. In other countries like South Africa, I think they handle it a little bit differently. Care tends to be integrated into the general care, and the clinic that we work with there is actually it's an adolescent health clinic, so it's pretty unique in Johannesburg. So I think it just varies on where you are, but the space is really important, and how that space is perceived and how that space is signed and everything in terms of stigma and discrimination and in terms of people feeling comfortable going to care. So those are the kinds of things that health policy and planners really need to think about when they're determining how to set up those clinics and in a non-student.
I have a question for my dad. Just out of curiosity, is there any community in the country that you've seen be very accepting and just educated community where the young women feel safe to go more than others?
I mean, it's in terms of stigma and discrimination, it's not like people are things have changed in the last 20 years. So it tends to be a lot more nuanced in terms of how people experience stigma. So it's not like they're pushed out of the house, but they may get less resources, or they may have to do more housework, or they may not get the same opportunities other family members or other kids might get. So that it's not as overt. And I think what's actually one of the bigger issues is not the actual experience of stigma, but the fear that it will happen. So your anticipation of it happening, and also what we call internalized or self-stigma, which really leads to depression and poor quality of life and poor health outcomes. And so that's why, so in terms of interventions, what we want to suggest is both support interventions for individuals to help them sort of deal with internalized stigma and anticipated stigma, work in communities to help people understand how what they say is perceived by others and what they do, and to work with your teachers and your healthcare providers who really need to understand that as well and make sure that they're doing the best they can to provide supportive care So it's really, we often do stigma reduction programming sort of by socioecological level and talk about how it's really important to address all of those levels in your programming so that you can try and be most effective.
Well, I want to thank Daniel, Ann, and Karen for providing recommendations and lessons learned from your projects. Please feel free to talk to them if you have any more questions, and we have also refreshments. ICRW, we have these monthly series every month, and so you'll be hearing from us again. Thank you.